Really good question. So broadly speaking, you have two options: what's called an immediate reconstruction, which means at the same time you have a mastectomy, you have a breast reconstruction, or a delayed reconstruction, which means you have a mastectomy, you have a mastectomy scar, that all heals, you get over that, and you have a reconstruction later. And this is a big question, and probably something that I'm not sure I can do justice to on this. And it's really something you need to discuss with your surgeon or surgeons, because it depends on several things. It depends on you, and it depends on the sort of treatment that you need. So on you, a lot of it is sort of the psychology of it. Sometimes people feel that they like the thought of going down to theatre with a breast and coming back with a breast. Psychologically, that's a appealing thing. Obviously, not sometimes. I guess everybody finds that appealing. So that's a good thing about having an immediate reconstruction. You go to theatre with a breast, you come back from theatre with a breast, albeit a reconstructed breast. So that is a good thing. The bad thing is that when you have a diagnosis of breast cancer, that's quite a major thing, and often you need surgery quite quickly, and psychologically it can be quite a lot to take in. If you then have to start taking in the whole gamut of breast reconstruction, there's so many decisions with breast reconstruction. Oh my goodness me, it's all too much. And you might say, look, just do the mastectomy. It's a relatively short operation, get that done, and then I can consider a reconstruction later. Because a mastectomy on its own is a sort of average operation, not that big an operation, but a mastectomy with an immediate reconstruction can be a big operation. So you can turn a sort of medium-sized operation into a big operation at quite a vulnerable time when you're quite psychologically in turmoil because of, you've been given this diagnosis. So you might say, I can't face it at the moment, it's all too much. So you've got to think of it from your point of view, where you're at, whether you want to just come back with a breast and you're well from when you go to theatre, and you're willing to put up with a big operation to achieve that, and also whether you're willing to go through the turmoil and the decision making in terms of breast reconstruction, because there's all sorts of different types and pros and cons of all of them. So there is that. Then there's issues in terms of the disease and the treatment that you need. So it depends on what sort of treatment you need in terms of the mastectomy, and whether you need any what's called adjuvant therapy. Adjuvant therapy is things like radiotherapy and chemotherapy. So, and often they can tell before, sometimes they can't necessarily tell before whether you're going to need it, but often they can tell you before whether you're going to need adjuvant therapy. If you need adjuvant therapy, if you need radiotherapy sort of blasts the area once you've had the mastectomy, or it could be a wide local excision. If you have a wide local excision, you pretty much always need a radiotherapy, and kills any remaining cancer cells that are left behind. Now, if you do an immediate reconstruction where you put the tissue up there at the same time as the mastectomy, when they do the radiotherapy, they're going to blast that reconstructed tissue. So it can damage your reconstruction in terms of causing some scarring and some abnormalities of shape. Now, there are significant benefits of having an immediate reconstruction, so that might be outweighed by that risk of the radiotherapy being blasted. But some surgeons say, look, if you have any radiotherapy, have a delayed reconstruction, don't have an immediate. I'm not like that. I do think there are benefits of having an immediate reconstruction, particularly if you're going to use your own tissue, something like your tummy tissue. So I think there are benefits to having a reconstruction, but it's true that if you were going to have radiotherapy afterwards, that can damage the reconstruction. To what extent and whether that would mean you need another operation or whatever, it's hard to say, it's hard to quantify. But obviously, if you have a delayed reconstruction, you'll definitely need another operation. So that's what I mean about not being able to answer it properly here. It's really something you need to talk to your breast surgeons and your reconstructive surgeons, or you might be the same person about that. The other bit of adjuvant therapy you might need is chemotherapy. Chemotherapy is sort of drugs to kill any cancer that might be in your body. Radiotherapy is more of a directed treatment. Chemotherapy is more of a systemic thing, and that can be important to remove any cancer that might be in your body. If you have a mastectomy on its own, you just have one scar, and you've got to get that to heal. If you have a mastectomy reconstruction, you often have more than one scar, because you might have had a reconstruction from a bit of tissue from your body, and it all might be tight, and there's more risks of wound healing problems, and there's more risk of complications if you're having an immediate reconstruction. And so if you do get a complication, if you do get a wound healing problem or something like that, that might delay your adjuvant therapy, particularly your chemotherapy. It might delay they might not want to give you the adjuvant therapy if you've got wounds that need healing. So you might say, well, that's going to jeopardize my cancer treatment. I need to get this adjuvant therapy. I need to get this chemotherapy to mop up any cancer cells. And if there's a chance that having an immediate reconstruction might delay that, that might factor into your decision making. You might think, hold on a minute, I just want to get the cancer treatment done first, and then next year I'm going to think about reconstruction. You know, it's different things for different people. So that's one reason against having an immediate, that it does make it potential that you might have a delay in your adjuvant therapy. Not necessarily, but more likely than if you just had an immediate reconstruction. Finally, the cosmetics of it. Cosmetically, an immediate reconstruction is far superior to a delayed reconstruction. It does look a lot better. The thing about a delayed reconstruction, if you've got a breast with lots of skin, when they do a mastectomy, they're not really interested in taking the skin. The only skin they're really interested in taking is your nipple and your areola. That's all they really want to take. So when they do a mastectomy, if you're having an immediate reconstruction, what they sometimes do is just make a scar around the nipple and the areola, take that out, and then take the rest of the breast out through that incision. And then when you're doing a reconstruction, you can fill that skin envelope with your breast reconstruction and just use a little skin paddle for that nipple, and then you can reconstruct the nipple. So actually, once you've reconstructed the nipple, it looks like you've got no scars because you only had a circular scar, which is then swallowed up by your areola reconstruction. So cosmetically, all that skin's intact. Your inframammary fold, the fold where your bra sits, is intact. And so cosmetically, it's a lot better to do an immediate reconstruction. With a delayed reconstruction, you can't leave that skin. If you're not putting a reconstruction in, you can't leave that skin hanging there. So you have to cut the skin out. So you end up with a much bigger scar. When you do delayed reconstruction, you end up with a mastectomy scar, which is that oblique scar across your chest. And then when you're doing a reconstruction, you have to reconstruct the inframammary fold because that's gone and you just have a flat chest. And you have to bring much bigger skin paddle in because you have to import skin from somewhere, or you might use implants or what have you. Then you have to stretch the skin. But you have to, it's a more difficult reconstruction, and cosmetically it's never as good really a delayed reconstruction as an immediate reconstruction. So tricky one. No answers there. Pros and cons for both of them. Needs a proper discussion with the surgeon or surgeons. But that's some of the issues around immediate and delayed breast reconstruction. But really good question. Really like that. It's a good question.